Hello everyone, thank you for joining me. My name is Dr. Jason Uchida. I'm a doctor of naturopathic medicine and your host of this program. Welcome to Island Wellness, a program that is designed to educate you about naturopathic medicine. Today is February 24th, 2013. I graduated from the National College of Naturopathic Medicine in Portland, Oregon in 1988. I've been practicing naturopathic medicine in Hawaii for the last 24 years. Naturopathic physicians are licensed in the state of Hawaii as primary care providers, just like medical doctors. We have a very special program lined up for you because we have two guests joining us today. The first guest brought himself in to see me in August of 2011 with one of the nastiest and ugliest skin infections that you may ever see. And yes, we have pictures for you too. If you ever wondered how naturopathic medicine would stack up against a severe skin infection that only antibiotics would resolve, stay with us to see if naturopathic medicine can heal a severe skin infection. Our second guest, Ashley, suffered from eczema and seborrheic dermatitis of the scalp. Stay with us to learn if once again naturopathic medicine can cure the incurable eczema. Before we meet our guests, let me give you a brief introduction to naturopathic medicine. Naturopathic medicine is a primary healthcare system founded on the honored universal principle that the human body has a mechanisms in itself to heal itself, no matter what the current status may be. Therefore, the human body is the ultimate healer. Furthermore, a physician's true role is to support this process by using the modalities of treatment that work in harmony with the body's natural healing ability. Hippocrates, the father of modern medicine, practiced these same principles thousands of years ago. Well, that's enough about me and naturopathic medicine. Let's find out if it works. To help illustrate this, I typically ask a patient to share his or her experience with naturopathic medicine with you so that you can get a better understanding of how this safe and effective form of medicine works. Today's first guest presented himself to my office in August of 2011. With a severe skin infection on the front of his neck, with it spreading up under the chin and below the ears. There are hundreds of yellow pustules infecting the hair follicles of the neck, under the jaw, and ears. His lymph nodes were quite swollen. He had no fever, sore throat, or pain. He did feel fatigued and nauseated. It was a severe hair follicle infection called folliculitis. I did not perform a culture of the pus, so it could have been Pseudomonas, Streptococcus, or Staphylococcus infections. To say the least, it was one of the worst skin infections that I've seen in my last 24 years of practicing naturopathic medicine. Dennis will tell you just how bad his skin infection was, why he didn't want to take the antibiotics, and was he worried the infection would get much worse. This would be a good time to introduce our next guest, Dennis. Dennis, welcome to Island Wellness.
Oh, thank you, doctor, for inviting me.
All right, so the audience probably has been watching or looking at your photos of when you had the folliculitis or the skin infection. So do you recall what happened to bring the folliculitis on and onto your neck, chin, and jaw?
Yeah, it was, I'm pretty sure it was when I went to the Philippines, my Philippines visit. We were swimming in a local river.
Oh, okay.
And I think I shaved that day too, that morning prior.
Oh, okay.
So that opened up my pores.
Mm-hmm.
And I was still, going through the eczema treatment.
Mm-hmm.
I've had that long history of eczema, and I think I had scratched an area while I was in the river. And that's where I guess I obtained the infection.
Yeah, the bacteria or whatever.
Right, and then so when I came back, when I left the Philippines, it started right at, there was like a sore above my lip.
Okay.
And I thought it was just, a typical...
Like pimple or something?
Yeah, a pimple or a cold sore or something,
Mm-hmm.
just nothing too serious.
Right.
And that's when I left the Philippines.
Okay. And then when did you see me after that? So how many days after?
Couple days when I arrived back on the islands, it got worse.
So
it started to
2
spread.
or 3 days later,
it was less than a week. It was like maybe half a week. Open
Okay.
it, yeah.
So it escalated pretty fast
Yes, it did.
because you had hundreds
Right,
of
right.
infected hair follicles.
Yeah, it went to just that one spot to like hundreds of those.
to your whole neck
Yeah, to my neck.
and
above my
under
neck,
your jaw and
chin.
chin.
Yeah.
Okay. So, you know, a lot of people are wondering, you know, your infection was pretty bad.
Mm-hmm.
And I even told you that you should get antibiotics.
Yes. Yeah.
But you chose not to, and you actually kind of went back and forth on it. You know, you need to get antibiotics. No, I'm not. You need to get antibiotics. No, I'm not getting it.
Yeah.
Now, why didn't you want to get the antibiotics?
Well, I've had a history with you.
Mm-hmm.
So you've treated me before with natural medicine with my eczema.
Mm-hmm.
So I had a good relationship with you. But prior to seeing you, I've done a lot of treatments with steroids,
Mm-hmm.
Immunosuppressants,
Mm-hmm.
and antibiotics.
Right.
And you know they worked for me for a little while, but it made it made my conditions worse.
Over
eventually,
time.
Over time.
Mm-hmm.
And I was doing this since childhood.
Mm-hmm.
So I kind of lost faith in that.
Okay.
And and then when I met you, I've had I got a good relationship with you. Had a
Mhm.
history with you.
Mhm.
So I thought, hey, I had total trust in
Okay.
in your system.
Okay. You had seen me for eczema before.
Right,
so,
right.
And you had a pretty bad case. And I guess during the first visit, you learned that taking antibiotics and immunosuppressive drugs, corticosteroids, was
Right.
causing your eczema.
Right.
So I'm sure that was in the back of your mind.
That
too.
was
If I
in the
take
back of my mind
antibiotics,
Yeah, it was.
it's going to make my eczema
It's just gonna counteract what
we're doing.
what we're doing.
Okay, to get you well.
Right.
But you also mentioned that when we were talking earlier, that you did have a skin infection behind your knee,
Yes.
like months before,
Right.
and
Yeah.
that we took care of naturally.
Right.
Right.
Exactly. Yeah. So you treated me for something similar before,
Mm-hmm.
and so I remember that.
Okay.
And so I thought I could do it again.
Yeah.
I mean, the condition was much more severe
Mhm. To your neck.
to my neck than
Mhm.
it was in my legs, but so
So that's the main reason why you chose
that was the
not to
yeah.
get the antibiotics and to see me.
Right, and I had total trust with you, and you left it up to me, but you gave me the option that if we have to, we can do the
Antibiotics.
Yeah, I would highly recommend that you do the antibiotics.
Okay.
So I had
So
total trust in you.
okay, so you didn't feel alarmed that I told you about the antibiotics.
About going to seek
Yeah.
and get antibiotics.
Yeah.
Well, half and half, I guess.
Okay.
Because
So
I-
you knew it was a serious infection,
I knew it was serious, but I thought it was.
something we could handle.
Yeah, I thought we could handle it
Okay.
with your treatment
Yeah, because we took care of it before.
before, right?
So not meaning that I don't have faith in naturopathic medicine, but antibiotics would have taken care of that too. Most people
Right.
would have gone and sought antibiotics, and it most times would have taken care of the infection. So
Mm-hmm.
and it probably would save maybe us some worry, anxiety. But
think so.
you weren't worried.
No, I wasn't worried.
Okay.
I mean, I've had a good history with your treatment.
Okay. So you came in to see me for the infection one day,
Mm-hmm.
and then what was the treatment that we put you on? Do you recall?
Okay, so I know it meant part of the treatment was keeping the area clean,
Mm-hmm.
and so that meant like not touching it. I think you gave me some kind of was it betadine or some kind of
Yeah, betadine.
some to clean it,
Clean it, disinfect it.
disinfect it, and I think I did that morning and night.
Mm-hmm.
And then there was oral medicine,
Mm-hmm.
but you explained that as like natural antibiotic medicine, right?
Right.
And then at night before I went to bed, I had my girlfriend help me put on this mud mask or this
Yeah.
mud treatment.
Right. Clay packs or a
Yes.
clay mask
Right.
to help draw out the pus and the poison.
And then during the day, I had put on this ointment.
Antibiotic ointment.
Yeah.
Okay. So, and I had you come in a couple of days later, right?
Mm-hmm.
And I had mentioned to you, like, if it gets worse, maybe we might want to use antibiotics.
And it did get worse because you said that it might. If you kept telling me we're gonna have to keep a close watch that if it keeps going further below your neck or start spreading
Up.
and it did. 'Cause
Right.
it started traveling
Up
up
the
towards,
size of your ears.
So yeah, and then started traveling down towards my clavicle.
Mm-hmm.
But I still wanted to stay the course.
Mm-hmm.
But you did give me that option.
Yeah,
I mean, you
yeah.
said that, if you want to, you can go and seek antibiotics, and I stayed the course though.
You did not want to take those antibiotics.
Yeah, but I mean,
Were you getting worried that it was spreading?
I was.
Yeah, because it was spreading up, to the
I was
top of your
worried,
ear,
but I
the
had-
back of your neck.
Yeah,
And the pustules were actually getting larger.
and it wasn't just the sight of it, and it was really how it made me feel.
Okay.
It
Would you
was-
explain that?
It was really painful.
Okay.
It was very uncomfortable. I mean, I remember trying to. It kept me bedridden. I couldn't even. I didn't want to get out of bed. Well, actually, I was sleeping on my couch, and trying to go to sleep. Just knowing that those hundreds of pimples were all over my face and neck,
Mhm.
and how painful it was.
Mm-hmm.
Even when I put on the mask, I could just feel the mask tightening my neck, and it made it even worse, the pain.
The
The treatment. I mean, I knew the treatment was doing good, but it made it feel so bad.
Yeah.
I could just feel that poison coming
coming out.
but it was painful.
Mm. And the poison was actually coming out because the pustules on that 2 days after I first saw you were actually bigger. Yeah, they were
Right,
about
right.
twice the size.
Right.
That
that was part of the process you explained.
right of removing the toxins.
Mhm.
So how were you feeling at that time when you start noticing, man, these pustules are larger, you got more folliculitis, and
Like I
they're
said, I
spreading?
felt worse. I
Mm.
felt I didn't want to do nothing. It kept me out of work for a week at least. I remember.
Yeah, okay.
But yeah.
Okay.
You explained that it's gonna get worse. You're probably gonna feel worse. So I expected it. So I wasn't surprised. And
Okay.
and so yeah, when it happened, I wasn't too surprised.
All right. Did you know the infection was serious?
I knew it was serious, but looking back, I see how much more serious it was. I mean,
Oh, okay. Now that you've seen the
now
pictures
that I've
again.
seen the pictures and we've talked about it, and he invited me to the show, and wow, I didn't think it was that serious.
Okay. So actually, I have here the Dennis that 3 days later.
Mm-hmm.
So this is 5 days from the first time I saw you. You were about 75%. No, wait, yeah.
I took your recommendations at heart. I mean, if you felt that I needed to go immediately and take antibiotics, then I would have listened. But you gave me the option, so I
Mhm.
opted to do
Natural medicine.
the natural medicine. Because
Mhm.
I felt that if you gave me that option, then you felt that
It would work.
there was a possibility that this will work.
Okay.
You had you wouldn't have recommended it if you.
If I didn't think it was
Yeah.
going to work. All right. We should talk about the supplements before
Okay.
we go any further because you had mentioned that You were taking a few supplements.
Mhm.
Some work like antibiotics.
Mhm.
The audience probably really doesn't know what they are. So these are herbal and vitamin formulas,
Mhm.
combination of herbs that are in there. And what they do is they stimulate the thymus gland and the bone marrow, which are our immune system organs. They make the white blood cells to make more of its own antibodies.
Mhm.
So we were making more antibodies in your body by asking your bone marrow and thymus to fight the infection.
Mm.
So the beauty behind your thymus and your bone marrow making its own antibodies is that it will make the appropriate antibiotics
Mm.
to kill whatever is causing the infection. Whereas if you go to a medical doctor, they may have to culture the serum or the pus to determine what bacteria is there, and then they can give the appropriate antibiotic.
Oh.
But your immune system makes the right one for you.
I see.
We just have to ask it to work extra hard. So we gave Dennis actually 2 formulas to take, 2 immunostimulating formulas. Normally, we only use 1. Say somebody has bronchitis, we're using 1 of the 2 formulas. But for Dennis, I felt we needed 2. And Dennis was taking 2 capsules of each, like 5 times a day,
Yeah.
taking a lot of pills. So, Dennis, would you tell the audience, though, trying to take care of the infection,
Mm.
what did you do? I mean, you explained it a little bit, at night, you would use the clay backs.
Well, I had a lot of rest. I sought a lot of assistance from my family. I tried to stay comfortable and tried not to touch the areas as instructed by Dr. Uchida. And then I followed the regimen,
Okay.
taking the oral medicine and then the topical, applying the topical treatment,
Using the betadine
using
to
the
disinfect.
keeping it
Clean.
clean and disinfecting the area, and then applying the ointment throughout the day,
Okay.
and then going to bed with the mud mask on my face and neck.
Okay. When the infection got worse, did you do anything more?
I didn't do anything more.
Okay.
I
You mentioned you stayed the course.
I stayed the course.
Okay. Because basically, I told you on that second visit, stay the course.
Yeah.
Right. Okay. What happened on that third visit? So 3 days after the second visit, when it had gotten worse. Do you recall?
No, no.
Okay,
I,
okay.
I don't know.
So actually, you had gotten significantly better at that time. You're about 75% better. The wounds had really gone down quite a bit. Do you recall how you were feeling?
Oh, I
At
mean,
that time.
Yeah, then I was feeling much better. My energy level was was higher,
Mm.
but and the pimple formations were looking, well, it wasn't too swelly.
Yeah.
It was a lot smaller.
Smaller. Not as red.
But they were still, it was still traveling
Mm.
down and up, but then it was just smaller.
Mm-hmm.
And
Looking
somewhat-
like it was healing.
Yeah, and like how when a cut, when you get a cut and then it hardens and then it starts to fall off.
Mm.
So there's a few of them still, those started to harden and fall off. And so yeah, it was getting better.
All right. So, would you tell the audience about how long it took you to go from that first visit to the last visit where your folliculitis or the skin infection completely healed? Do you recall?
Like I said, I was out of work at least a week, so it must have been just over a week.
Mm-hmm. About
Where-
8 days,
yeah.
actually. Yeah.
Where it cleared up a whole lot.
Mm-hmm.
So
Okay.
yeah.
So, did you think it would take that long, or Did you think it would take longer to go through that skin infection? Because it looked pretty bad.
Well, because I had a history before with that's similar infection,
On your leg.
I wasn't too surprised that it took that long.
Okay.
But it felt a whole lot longer though. Just because how I was feeling through the week.
All right.
I mean, I just wanted to go away.
Okay.
That's just
Yeah.
the way it felt and the sight of it. But yeah,
Right.
I wasn't too surprised.
Okay.
How-
You mentioned that you were pretty tired. Can you tell the audience, besides having the skin infection, you had a couple of other symptoms? You had mentioned some
Yeah,
pain, but
Had some pain, some body aches. I didn't have the fever or anything.
Yeah, you
I
had
didn't
no
have-
fever.
I wasn't like having flu-like symptoms. It was just, I was just pain. So it made me. It just sucked up my energy, and so I was like lying on my couch, practically maybe. If I wasn't doing the cleansing and the disinfecting and taking my medicine, I was sleeping.
you're sleeping.
Yeah.
Yeah. That's probably why you healed so well, because you've rested and your
Yeah,
body
I rested.
needs
That
the
was
rest to heal.
Yeah,
Yeah.
that was a big part.
All right. So you felt really fatigued.
I really felt fatigued.
Okay.
Yeah.
And you also felt a little nauseated too on that
Yes,
first
yeah,
visit you came
I
in to
did.
see me.
Yeah.
But other than that, no other symptoms.
No
Yeah.
other
Okay.
symptoms. Yeah.
All right. So Dennis, would you tell the audience what are your thoughts about naturopathic medicine, not only in its ability to treat chronic infections,
Mhm.
but also acute infections like severe skin infection?
I guess I want to let the audience know that Dr. Ichida's has helped me with my eczema issue by using the Candida diet, and by introducing me to the Candida diet, it allowed me to be aware of what I ate and how it affected my body.
Mm.
So I guess that's the most thing that I wanted to get across to the audience.
Ah,
Is
okay.
that it's you need to really pay attention of the food that you eat, how it affects you. 'Cause
Right.
It makes a big difference, and I can speak from experience.
I would agree, as well as a lot of my other patients. So you have noticed that when you eat certain foods,
Yes.
how it affects you negatively,
Yes.
Yeah.
Yes. Yeah.
and if you eat other foods, how they affect you
Yeah.
positively.
Right. And I knew there was foods out there that affected me negatively. I mean, I saw an allergist and he told me just stay away from this.
Okay.
But I didn't realize that there was more to that.
Right.
You know? I was, one thing was like how bad sugars can play
Oh, okay.
in health. Yeah.
Have you noticed the relationship between sugars and how you feel?
Yes, I have, and it's allowed me to pace myself. Yeah, I mean, I do indulge, but I know I'm more aware
Okay.
that maybe not now, because of how I'm feeling.
Okay.
Because I know what it's gonna make me feel, how it's gonna make me feel,
Right.
and so yeah, that awareness that you brought on me, that was a big thing.
All right. That's good to
Yeah.
hear. So you have you understand more about your body now and how your
Yes.
body, how you feel, might be related to what's going on or what you're eating.
Yes.
Yeah.
Right.
So if we can get more people to pay attention to that, I think we
Yeah.
maybe have better health in America.
Yes. Yeah.
All
so
right.
yeah.
What would you want to say to anybody who, has eczema or a chronic or an acute skin infection?
Just to not give up and be open. I mean, I've had this. I'm still treating this condition.
Mm.
I'm still fighting it till this day, since I was a child. So,
Mm.
and I've done everything that I could think of, and I almost felt helpless.
Yeah.
But yeah, I can sympathize with people feeling that way,
Mm.
because there's days where I feel like, I feel like crap, and that there's nothing that can help me. But
Mhm.
there's options out there besides, what you're doing now.
Yeah.
Yeah.
Taking medications,
Yeah.
using
So-
corticosteroids.
Right. So don't think that that's the only option,
Mm-hmm.
and that not to give up. Go seek help in other ways, and don't be afraid to go and seek alternative help.
We treated you for eczema,
Mhm.
and the audience has heard about the diet, the
Right.
change, right, that we ask you to stop eating simple carbohydrates and a few other foods. Was the diet tough to do?
It's not easy.
Okay.
It's not easy. I mean, but it's doable.
Mm-hmm.
Because I did it for a year. I did it for 1 year straight, and I saw the best results when I did it for 1 year straight.
Yeah, you did a good job.
I did a good.
Yeah.
I mean, yeah, and there's several things from that diet, and that Dr. Uchida has introduced me. I still keep to this day.
Oh, very good.
So,
All right.
yeah.
But most patients say the same thing as you. No doubt it is difficult.
It is.
It is difficult.
So-
We're not trying to pull anything over your head.
Yeah.
Everybody says it's tough, but it's
Right.
doable.
Right.
Yeah, and all you need is desire,
Right.
right, to get well.
Yeah. 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 That's true.
Dennis, you were introduced to me, or someone told you about me. Would you like to say something about that? Where that connection comes from?
Yeah. There's two people that recommended me to you.
Mm.
So one person was a coworker of mine who's
He was on the program too.
yeah.
Milton.
Well, yeah. They're both actually coworkers.
Oh,
of
okay.
mine.
There's another one. They
Yeah.
were both on
No,
television?
no.
Okay.
Milton was my apprentice instructor
Okay.
at the shipyard.
Okay.
But prior to meeting Milton,
Oh, okay.
there was a woman on your staff, Ellen,
Oh, Ellen, yes.
your
yes.
sister-in-law, right?
Yeah.
Yeah. So she was a coworker of mine at Holly Coral,
Oh, okay.
and so she also mentioned about you and your treatment.
Oh, okay.
So yeah, so there was two people.
Oh, okay. Okay. Yeah, good recommendations.
Yeah.
Dennis, our time is up. I want to thank you for joining us and sharing your amazing story on
No
Island Wellness
problem.
with
It was
us.
a pleasure.
All right, thank you. And
right.
success, continued success to you.
Oh, thank you.
I'd like to thank all of you for tuning in and joining us today. I hope you enjoyed the program and learned something of value. Our hope is that these stories inspire in you the hope that true health is attainable and you can have it whenever you are ready. Please continue to look for and tune into Island Wellness on Olelo Television. We have more incredible, heartwarming stories of people overcoming incurable disease and illness in the next few months. Watch Ron tell his story of beating the incurable and disabling multiple sclerosis. And follow Jason's epic battle against the deadly genetic cancer, von Hippel-Lindau disease. My name is Dr. Jason Uchida. Thank you. Good night.